I really do feel why the Bladder Cancer Program at Colorado Urology is unique is that it is comprehensive, really in all facets of care. For our non-muscle invasive bladder cancer patients, we are able to provide cutting-edge technologies such as blue light cystoscopy, where we're able to help detect disease and more fully evacuate the disease during our resection of those tumors. We're able to provide our patients with unique urinary biomarkers to detect recurrence, and then as well as able to provide all updated intravesical therapies for our patients, as well as clinical trials. For our patients who have more invasive bladder cancer in advanced stages, we do a number of things to help our patients, such as provide them with an opportunity to present their case in a multidisciplinary tumor board, such that we can review and ensure an accurate diagnosis and stage of their disease, and where a medical oncologist, radiation oncologist, as well as myself and some of my esteemed colleagues can review the case in a roundtable discussion and come up with an individualized and up-to-date treatment plan for them through this journey. We provide an enhanced recovery care pathway for these patients alongside our anesthesia team and hospital care team, which allows these patients to get through their hospitalizations in a shorter amount of time with less complications. And through this, they're able to also have access to a variety of ancillary services such as physical therapy, nutritional services, and ostomy care. Colorado Urology has done a great job with providing support services for their patients. Specifically for our bladder cancer patients, we have created a semi-annual bladder cancer support group. And what this does for our patients is it really provides the patients with a camaraderie amongst themselves, family members, caregivers, so they don't feel isolated. And then at each of these support groups, we do have a guest speaker come in to educate the patients, whether about their disease, management of side effects, how they can be more healthy and have better mental and whole body wellness. Our patients really have found these support groups very useful. Now, for all of our other patients at Colorado Urology, we do offer a care management service. And this is a really nice support service for our patients where a care team contacts the patients and helps them with scheduling office visits, medical management, refills of their medicines, and other ancillary services. Clinical trials are an extremely important part of a patient's journey with bladder cancer, especially in the superficial bladder cancer space. There are a lot of new therapies coming out for superficial bladder cancer. And because superficial bladder cancer has a very high recurrence rate and really has changed into what we call in the medical world a chronic disease, as people are living with superficial bladder cancer for decades. Their cancer learns how to evade or outsmart our standard therapies. And so clinical trials come into play when an individual's disease has outsmarted standard therapies.